Hey, this is Dr. Pre, making a quick video here to show you all how to get a Dexcom G7 continuous glucose monitor set up and on you. We'll also look at how you can calibrate that Dexcom G7 and open it up in the app to calibrate that and then share your results with your provider. For this video, I'm going to start off with everything that you need, all the supplies, talk about where you can place it, and then show you where you can get the app, add in that calibration step and the whole kit that you need to calibrate it. Use those typically. If it allows you to calibrate, you need a prescription for it. There are direct-to-consumer options. There's one called the Stello, which is from Dexcom, and then there's the Lingo, which is from Abbott. Those cannot be calibrated, so you can skip that step. Whether or not you want a calibrated one is a separate topic that you should talk to your provider about. The short version is it depends on if you're trying to really precisely determine your blood sugar versus just follow the trend and see what foods change it. Let's talk about the different items that you'll need. This has the Dexcom G7. In that, you're going to get the applicator. It's what we'll use to put the device on. And then you'll also get a little bit of tape like this, which will be used to secure the device. I just go with the standard tape they have here, but some people find different tape works better for their skin. The other thing I recommend having is just some way to clean your hands. Here's a little bottle of hand sanitizer. Let's talk about placement. The Dexcom G7 is FDA approved to be placed on the back of your arm right here. It's not necessarily the best place to place it. I actually have a different preference. All that really matters is that you are able to get it on there and get accurate readings. Some people place it on their abdomen, the side of their arm rather than the back of their arm. Some people go inner thigh, lower back. I prefer that upper front area of the thigh because it's a little more discreet. Not everybody sees it. I don't really run into things there. It doesn't interfere with my sleep. Those are the main considerations in terms of placement. All right, let's get into placing the device here. The first thing to do is to clean off that area that you decided to put it on. For me, it was my upper thigh. If you have hair on the area, some people say when the tape comes off, it can hurt. I don't normally have that problem, but if you do, you could go ahead and shave that area first. So we're going to take this applicator and we're going to keep this because we need it to link up the device we have with the app on our phone so we can see those glucose readings. First, go ahead and open it up, counterclockwise screw it. You can see in here, here's what it looks like. That little filament is what will go inside of you. So you're going to push this up against your skin and then push this side button and that'll inject it at where it needs to be. Okay, so I'm going to go ahead and show you that on myself now, putting it on my upper leg. Gently rub around the sensor to make sure it got in there and lightly hold it down for 10 seconds. And by the way, this didn't hurt at all getting it on here. It was completely painless. Next step, we want to put this on, this adhesive, to make sure that it stays. Essentially, you take off the back parts that are not sticky, you line up the sensor in this hole here, put it on, peel off the colored part, and you're good to go. Let's go get the app. If you go to the App Store, type in Dexcom G7, you'll see an app that looks like this. It's got a green symbol on it. You're going to click on it. You'll see I already have it downloaded, opened up. iPhone settings, we'll get to that in a second. I want to show you what that is. But first, let's make sure we get the sensor paired. Do not hit this plus button on the top. It's a bit confusing. That's how we'll do our finger stick. But rather click on the bar that says Start New Sensor. Okay, and now you'll see it's showing an image of the applicator where we need to take a picture of that QR code. That's the easiest way to scan it, which is why we kept the applicator. Here's the one that I used. Go ahead, scan that in, and it basically does all of the work for you from here. You can press here that the new sensor is installed because we already did that, and it's just going to load here. And you'll notice that there's going to be a little bit of a warm-up period after it pairs. Go ahead and pair. I haven't ever had an issue with finding it. You'll see the sensor is paired, but I have a 19-minute warm-up period here. Here, I'm going to show you how to turn off these alerts here for the Dexcom. If you go into the app settings and alerts, you'll see here we have urgent low, high alerts for different settings of the blood glucose. And if you look here, I've turned all mine off through the notification center on the app. So you can go to your settings to go ahead and turn them off. And as I'm showing you this on screen, so this is just your normal notifications on your iPhone or Android, it would be the same thing. The reason that I do this is because in the middle of the night, you may accidentally roll onto your device and it will have a blaring alarm, waking you up. And we're going to set up the Clarity app. So we already set up the Dexcom G7 app. That's what we use to get our data onto our phone from the sensor. But the Clarity app really helps us visualize this data much better and longitudinally. So you can see here at the top of the screen, you can get 2 days, 7 day, 14 day, 30 day data or longer. And if you go over to the profile, what you do for this Clarity app is you just log in to the same account that you made for the Dexcom G7 app, and it will automatically sync. If it's not syncing, go over to that G7 app and click on connections. You'll see it at the bottom and look for that to make sure you're on the same account. Now, as you can see here, I'm going through the different views of times of views that we have here. And I really prefer to look at this in the daily view. And if you click view report, I had 14 selected there. So I'm going to see 14 days with a daily view because you can get a good sense of the curves. You can see where your blood glucose might have spiked, which days maybe you were stressed and you had a higher baseline level, etc. You don't have to interpret it, but I want you to be able to see that data. It's the same data that the clinic will see as well, which is the second part of what I want to show you with the Clarity app here. As you can manage your data sharing with your clinic, just press continue here. Your clinic will have a code. As you can see at the bottom, I'm connected to Vita Veda, my clinic, but you'll get that code directly from your clinic. And that's pretty much it. Here's how to calibrate your continuous glucose monitor. Here's what you'll need. One purchase is a kit. It comes in a little black case. It's got a little device here. It's got these little things that prick you. And then it has a monitor. The separate thing you'll need are these little testing strips, which are sold separately. Wash your hands with soap and warm water before starting this. That's the official way to do it. I'll also use some Purell to make sure my hands are dry and clean. You're going to pick a finger, and what you're going to do is you're going to stab one side of that finger to get a drop of blood, and that drop of blood is going to get sucked up on these little black dots here. You're going to choose one side, just put it right up next to that drop of blood, and that'll suck it into this little strip, and this strip will be attached in your reader here. You see how I placed that in there, and those drops of blood will go down here with this device. How do you actually get yourself to get that drop of blood? So you start with this device here. You'll see there's an arrow. You just kind of tilt it on that arrow. It opens up into this little chamber here. Then what you're going to do is you're going to take this little lancet. It comes in a little pack of these lancets. There's a 10 pack that comes with it. You're going to just insert it, not the round part, but the other part, and shove it in as far as you can get it to go here. And you'll kind of feel it push and spring back a little bit. Then what you'll do is you'll twist off this round portion here. And when it is fully off, you'll see there's a tiny little needle there. Keep this top here, put it up on the ground. We'll use this to dispose of that lancet. Now you have that. Put the cap back on to this little pen here. You'll hear it click on there. And if you look at it, you'll see you can rotate it. And there's these little numbers that show up here where you rotate. And the higher the number, the deeper it'll get inserted. You rotate at the top, not at the gray part. To get it ready, you cock it by pulling it back here. And what you'll end up doing is pushing this little button to move forward the lancet. So I've recocked it. I have this ready to go. I have my monitor. I have my test strip. Insert the test strip here. We'll see it's asking for a drop of blood. Now all I need to do is try to get that drop of blood. Let's see if 4 is enough for me here. Okay, there we go. I felt it. got a little tiny bit of blood. Massage that, get that drop of blood a little bit bigger. Not so it's dripping, but so it'll be big enough to get a proper sample in our device. So you see how I kind of squeeze that out? And then you just put it right up next to it and let it just sort of absorb that blood. You don't need a ton. There we go. I have an 86. Now I can go ahead and calibrate that on my Dexcom G7. Now clean yourself off here. Throw away that testing strip. So removed from here. It's only good for a one-time use. And throw away the lancet. Remember, I asked you to save that cap. So you pop it off the side, off this pen, push it down into that cap to make sure that it is secured and you won't accidentally hurt yourself. And then go ahead and use this mechanism, push that little button again, and that pops it out. And just try to safely grab it, pull it out of there, and dispose of it. Okay, now you've gotten the Fingerstick glucose and you want to add it to your Dexcom G7 app in order to calibrate your device. So you're going to open up that G7 app and see here I have notifications off. One caveat from earlier, do not turn them off unless your doctor is okay with it. Check with them. Now onto the app on the top right, you see this plus sign. You're going to click on that and click the first option, blood glucose finger sticker calibration. For the entry type, choose use as a calibration and type in the value that you got from your finger stick device. The finger stick device is the source of truth. It's in your blood. Remember, the continuous glucose monitor is in your interstitial fluid, which is near your blood, but not exactly in it. This is really important for people who are diabetics and dosing their insulin. This is for longevity purposes. So if that is you, make sure you talk to your doctor about how to use it. Anyways, you add in the value, click confirm, and then you'll see that it says calibration saved at the bottom. It won't trigger right away. If you go to that log option at the bottom, you'll see calibration in progress. Sometimes it won't work right away. It usually takes 5 minutes, but sometimes it won't work even after 30 minutes, and it'll ask you to wait about an hour for the calibration. You can tell that because it won't have changed the values